I find myself looking back at my story with new language and new information, and sort of realizing the moments where perhaps the way that I was being treated had something to do with the color of my skin. At the time, that wasn't part of my conversation, but today we have statistics. We understand that this is something that's happening to Black women. I think of Serena Williams and doctors not listening to her. Her husband had to advocate for her. Her white husband had to advocate for her.
Education won't protect us. Money won't protect us.
Right. Our partners, our husbands, our children's fathers are not accepted in the same way. We were asked multiple times, who are you? Who is he? Why is he here?
It is really the fact that we're entering into a system that is racist. It is not because of our race, it is because of racism that we're experiencing these harms. And there's a fraught relationship between the Black and Brown community specifically and the medical system, because we have endured harm over hundreds of years. We have every reason to be skeptical, and it doesn't have to be an experience that we had. Your experience is enough for me to feel not safe. You telling me your story is powerful enough for me to say, hey, I don't want to go there because this happened to Lisa. And so when we're talking about protecting Black life, and the movement for Black lives has to start before birth. And when people talk about underserved communities, these are not undeserving communities. These are underestimated communities. These are people who would be thriving otherwise, but are being denied what their basic of human needs. Hopefully what we can do is start to work on an institutional level, work on a community level. It's too late. It's 2021. We really shouldn't be having people question whether or not they will be safe in having a child. That's a shame to live in a country where that's a thought in your mind.
So true.